I'm going to begin by performing a posterior pelvic tilt, followed with the knee raises that you're seeing now. This exercise is a good introduction to your anterior core or your abdominals and transverse and oblique muscles. It can get you started on working that aspect of your core without provoking, or at least it should not provoke, any pain or symptoms. The progression to that exercise would be to provide some resistance with your hands, as you can see in this portion of the video, where I am lifting my leg and then pressing into my thigh with my hands. This increases the level of activation or the intensity of the contraction that you'll feel in your abdominal muscles, again, without provoking pain. Now, if performing these exercises causes any pain, then we'll want to stop and take a look at them as soon as possible. Now, with the next exercise that's coming up, we're going to be switching to working on your lateral core. In this case, the side of your abdomen, your obliques. This actually ends up engaging your posterior core, so your lumbar spinal muscles, erector spinae as well, just simply by performing the movement. So you can see that I'm positioned on my knees and elbow, just looking to raise my hips until my spine is in neutral, and then holding that position for a brief pause before returning to the resting position. Again, we're trying to perform these exercises without provoking any pain or symptoms. Now, the next exercise is actually, I would say, more appropriate for somebody in acute pain as opposed to the side plank that we just showed you. This one is a lateral leg raise, and you will see activation of your core muscles when performing this exercise as well, except the activation is not nearly as significant because of the positioning. This one you'll actually also feel in your hip, in addition to your side, but definitely more so feeling it in the hip than in the side with this particular exercise. And then our final exercise is what's kind of commonly referred to as a bird dog. You're on your hands and knees, and we're just extending the hip. As you can see, I'm not even fully extending my hip with this exercise, but I'm extending it just enough that I can feel my glutes and my low back working to hold the position while still maintaining a neutral spine. This neutral spine is really important during the early stages of your acute pain, as we do not want to do any movements or exercises that are going to provoke your symptoms, and typically doing things in a neutral position is going to be the most comfortable position we can sit in. The second version of this exercise, or this is actually a modified bird dog because we just did the legs first, but now we're going to be doing the arm. Raising the arm is going to activate your middle back. You'll feel it working. And also the muscles that run into your latissimus dorsi, which feeds into your low back as well, is the short anatomy lesson. So this one will be a lower intensity for the low back than if you were to raise the legs. But both movements should be safe and pain-free, even in the most acute stages of a back injury.